WREX.com and click on the Mr. Food link. Hannah?
Hey, Greg, thanks. Well, today we are joined by Williams Manny Leon Rebodos. Did I get that right?
You got it perfect.
I've been practicing his last name all day, so I'm glad I got this right. You are here to talk about our recent healthcare reform and a lot of the ins and outs of things that people don't understand. So I want to start, first of all, about people in Illinois. When people go online to the websites, what should they expect and what should they be looking for when they're looking to shop for health insurance?
That's interesting. When currently, you know, the administration had 2.5 years to kind of get the websites up and running, and unfortunately, you're probably hearing about the fact that it's very, very difficult. Actually getting on and be able to enroll, very, very difficult to do. In fact, I think some of the most recent statistics I think we've heard of, one survey I saw, or one study I showed, 800 people tried to enroll and 10 were actually able to get coverage.
Wow.
So that's a very small percentage of people that are actually able to get coverage through the exchanges.
And why is that? Why is there such a why are people having such a difficult time getting on? Is it because everyone wants it and so the servers are backed up, or?
It's not necessarily that. It's because the amount of detailed information that is required to apply, people just don't have it readily available. So it's just people have to go back and forth, getting information about their spouses, finding out whether or not their employer has what's called a affordable plan or a plan that meets minimum value. It's just a very complicated process, Anna. It's very difficult.
So people should really do their research before going on the website, know what documents they need before they spend, you know, hours on the website.
Yeah, there's a very large carrier that actually had some of their own employees try to complete the form. There's an insurance carrier. Yes. And you know what? It took an average of 45 minutes to complete most of it. And that's for people in the industry that know our jargon, which is crazy.
That is insane. Okay, now you were talking about different types of insurance and different carriers sort of during our break. Tell us a little bit about that.
Yeah, okay, so anyway, the exchange does have 4 to 8 different carriers and about 160 different plans to choose from.
Okay.
That's very difficult. Enrolling is difficult, picking a plan is difficult, and you might have heard of what's called navigators.
Okay.
Those are people that are basically working through the government to help people understand how the benefits work. The limitation that they have, however, is the fact that they cannot actually recommend a plan for you.
Okay.
So that's a problem. I mean, I could talk to you about a plan all day long, but if you say to me, well, which one should I take? They have to stop. So the best route for most people really is to find an insurance agent, someone that's been doing business. For example, Williams Manny's been in the business 117 years. Someone that's in the business that understands the different carriers, understands the options, and fact finds what's best for you, and finds a plan and makes a recommendation, taking all that red tape and that decision-making process.
So they're basically like almost like a travel agent for your insurance.
Exactly, and here's the best part. It doesn't cost any different whether you go through a professional insurance agent or if you go on the exchange. So if you're going to pay the same amount of money, why
not get the extra
free service?
Yeah.
Why not get free service after
the extra?
Absolutely.
Wow. Well, we appreciate your time.
Absolutely.
Very nice to meet you, Leon. You're full of good information. Thanks so much, and of course, you know, check out Williams Manny or an insurance
agent. Absolutely. Just make sure you work with an insurance agent because, again, the costs are going to be the same, so we recommend you pick an agent that really knows what they're doing. And we have a full team of people that are specifically designed just to work with Obamacare and individual health insurance.
Awesome. Well, thank you so much. We appreciate it.
No problem.
Awesome. Coming up, we'll have your mom.